Hi, Dr. John Torres here with my Doc to Doc series, where every week I talk to an expert somewhere around the world. And typically it's about something coronavirus, about something pandemic, but we're starting to look at things outside the pandemic that affect your health and making sure that you have that information that you can use to help you, your family, your loved ones, and your community stay as healthy as possible and hopefully stay as happy as possible too. And to help me today, I'm very happy to have Dr. Barry Braun, PhD. He is the Executive Director of Human Performance Clinical Research Lab and the head of the Health and Exercise Sciences at Colorado State University in Fort Collins, Colorado. And Barry, thank you for being here with us.
No, thank you. It's a pleasure to be here. And, given some of the other guests you have, kind of an honor to be here too.
You're right up there with them. This is the reason I wanted to do this today. We're going to talk about as many things exercise as we can, is because we are truly starting to look at the end of the pandemic. Not there yet, but we're starting to think about, getting out more, doing those activities that we used to do before. But the honesty is, over the last few years, we've all been kind of couch potatoes. And so, we know exercise is healthy for us, so we're not going to talk about that. We know exercise has a lot of benefits. We're not going to talk about that. But want to get to some of the basics. And I guess the overall question is, how much exercise do we really need?
Yeah,
we'll start with a big one.
Yeah, it is a big one. And I'm so tempted to give you the real answer, which is it depends, but I know that's really unhelpful. But it does in the sense of, what is the goal? So if the goal is weight loss and maintenance of weight loss, the number is actually kind of intimidating in that, the data from the National Weight Registry suggests that it might be 45 to 60 minutes a day in order to, lose a substantial amount of weight and keep it off. On the other hand, there's a more moderate recommendation of, 150 minutes a week-ish of, sort of lower moderate intensity exercise to prevent diabetes or minimize the chance of getting diabetes. But, if the goal is mental health, happiness, reduction of depression or anxiety, it's probably a lot less, in terms of just getting outside and doing anything, benefits people in the short term, at least, in terms of, mental health and general overall happiness.
And so you bring up a great point, and this is something I often mention in medicine, is the answer truly is it depends. But the important part is doing something, right?
It is, and and thank you, because the public tends to really hate that answer of it depends. So yes, so going way back, and showing my age, Nike used to have this slogan of no pain, no gain, and we sort of moved on from that to this idea that anything counts, and that gardening or walking around the mall or parking your car further away, all counts, which is true. But on the other hand, we may have got a little too far in that, intensity does matter. And, probably some pain means more gain. So, it's sort of, you can kind of tune this in some way in terms of what the outcome is and how much benefit you get. But you're perfectly right. Anything is better than nothing. And the biggest change is going from no exercise to some.
And again, there's a lot of points here you're bringing up, which is fantastic. I think one of the biggest confusions for a lot of people is we hear that light, moderate, heavy exercise. Let's just focus on moderate. What would be moderate exercise? How would somebody know they're doing moderate exercise?
Yeah. So I actually have a little bit of a shorthand. I don't think I'm the only one who uses it, but it's kind of like this talk test. If you can speak in full sentences without any impairment at all while you're exercising, it's probably light exercise. If you're able to talk, but every sentence or two, you've got to take a few breaths in between, then it's probably moderate. And if you're kind of gasping and getting a sentence out and then gasping for air again, it's probably heavy exercise. And I think that's a lot easier for people to understand than percent of maximal heart rate or some other metric that is a lot more difficult.
And like I said, I think most of us know that, exercise can benefit our hearts. It can reduce diabetes, help with weight loss, longevity, all those good things. But what are some of the overlooked benefits of exercise that people just don't think about?
No, that's a great question. And I think, and I think our field has been guilty of focusing so much on things like lowering cholesterol, raising HDL cholesterol, lowering blood pressure, and haven't really given people as much information on how important exercise is to minimize the risk for getting cancer and minimize the risk for recurrence and everything that happens above the neck. Reduction in depression, reduction in anxiety, general overall well-being, just being a nicer person. All of the staff here are very glad that I go out and exercise hard on a regular basis, because when I come back, I am a better boss.
And that makes sense. Like I said, that same thing. I get out there And if I don't exercise, I can be a little grumpy because I didn't get my exercise in. If I do exercise, I'm just a happier person. It really helps, like I said, mentally and physically, which is fantastic. But yeah, arguably, especially since we've been through this pandemic, and a lot of us have been couch potatoes for 2 years, getting that motivation to exercise seems to be important. What advice do you have to stay motivated?
Yeah, and it's a great question. Probably the thing that we know the least about is that behavioral part of exercise. How do we get people to start? And once you get people to start, how do we get them to continue? And certainly this is a world now where we're imbued with information on our smartphones and information on Fitbits and other activity trackers. And the data on those is kind of mixed in the sense that if people buy an activity tracker or get an app on their phone for at least a short period of time, they tend to be more active. It doesn't generally last. Most of the evidence suggests that effect is sort of transient and doesn't necessarily last. If you add on sort of social support and networking and adding a social network piece to this, then some people are able to really continue it. But part of it is tuning what you're trying to do to the personality type. Competitive people respond to challenge. Some people need those constant reminders from their activity tracker. You haven't stood in a while, you haven't exercised in a while, and they respond well to those. That would not work well for me. I would take mine and throw it across the room if it started to give me lots of messages.
And some people are solitary exercises. I'm the kind of person, I do mountain biking. I like to go out with friends, but occasionally by myself as well. Other people are more social exercises. They want to go with a group at a certain time. And so it's going to depend on your motivation, and trying to find that motivation could be one of the keys, right?
Yeah, I think some of that is digging into the kind of personality traits, and that there are definitely people, and there's some good evidence from cancer survivors that especially women really tend to gravitate more to group exercise and are more motivated and tend to stick with it more if it's group exercise, and men less so. In terms of tending to like solitary exercise more. And some of that is again tuning the exercise intervention to the person, and being a lot more. I'm not gonna say personalized medicine, but personalized medicine.
One of the interesting things I thought I heard as far as motivation, and this is from years ago, and I've noticed it myself, it actually seems to work. So just a little bit of tips for people, and see what you think about this. But if you don't feel like exercising, one of the articles I read said one of the best ways to get motivated to exercise is to put on your exercise clothes, because that basically turns a switch in your brain of like, okay, I'm dressed, I might as well go out and exercise now. And so don't think of it as like, I have to go out and run 3 miles, but start thinking of it as, let me just put my clothes on. And then that kind of motivates you to start moving the steps you need to move into to get to that point where you're exercising.
I think that's absolutely true. And I think there's, I don't know if there are hard, double-blind, placebo-controlled studies to show that, but I think most of us believe that. Lowering the barrier in any way is helpful. And something as simple as being dressed to exercise matters. I know for me that, during the months of the pandemic when I was dressing as if I was going to work out at any moment, I really did work out at any moment. And on Zoom calls, I would do 100 push-ups, do 100 squats. Now that I dress like a real person again, I don't do that. So I think there is some evidence that, anything you can do to lower the barrier to get out the door or get started, including just being dressed to exercise, I think really does actually help.
You brought up these metrics that we use, especially these things like the smart watches, the fitness the watches, the apps on our cell phone that we use, and there's a plethora of them out there. And like you mentioned, some work better than others, and they work better in certain situations. Do you recommend a certain type of device to use, or do you recommend not using it as much and just relying on yourself?
Again, I think it's again tuned to the individual person. What is going to work for the individual person? And way back in the day, there was when heart rate monitors were a new thing. We all tried heart rate monitors, and I think some people stuck with them for a long time. Me, I borrowed one from somebody. I kind of figured it out in a week what it felt like to be at 130, 140, 150, and then I gave it back because I didn't need it anymore. So, I think some people will need that constant motivation that comes from, some device. Some people will use it, get it, and be like, okay, I don't need it anymore. So I think the individual device isn't as important as kind of, is it the one that works for you? Is a pedometer enough? Is knowing how many steps you took enough? Do you need feedback? Do you need it to actually give you, turn green or turn red or turn orange, when you've hit a certain milestone? So I think it's people sort of having a little bit of self-awareness about what motivates them.
Is there any metric that's better than another? Because like you mentioned, there's steps, there's heart rates, there's the, the color systems for not moving that much. Is there a metric that you favor?
I do think, given how much great evidence has arisen in the last 10 years about the problems associated with sedentary behavior or sitting, we like to say sitting is the new smoking, which, is probably an exaggeration. But, that idea of prolonged sitting is really a major health risk, and it's not the same as just not exercising. Like prolonged sitting really is its own health risk. And that anything you can do to break that up with, every 5 minutes or every 10 minutes to get up and do something and then come back. So I think that the activity monitors that track how long you've been sitting and give you some prompt to let you know that you need to get up and do something, I think for the majority of people, that would actually be, if I were to do one thing, I think that's the thing I would do.
That's good. That's awesome. And I always tell people it's the little things that count. So it's doing those little things during the day that add up and that tend to count. Exercise is great, but you want to make sure, again, you're not just sitting around for 3 or 4 hours, because that can take its toll. And in some cases, it can even negate whatever exercise you did, which doesn't mean not to exercise. It means not to sit around for 3 or 4 hours.
Right. Yeah, we call those active couch potatoes, the people, right? And, I'm sometimes one of them myself, that yes, I've gone out and I've, run hard for an hour, but the other 23 hours of the day, I did nothing.
Now, if it's okay with you, I want to do some myth busting. And so just go through some things here and find out, what your thoughts are these. If you're not sweating, you're not exercising. What do you think of that?
If you're not sweating, you're not exercising hard, but I don't think that means you're not doing physical activity and it's not beneficial. So, again, it goes back to what you said earlier that, exercising without sweating is great. If you actually, increase the intensity and start to sweat, it's probably in some respects even better, more bang for the buck.
And I tell people all the time too, that you bring up an interesting point, that it depends on what you're doing. Like you mentioned, if you're looking at weight loss versus looking at heart health versus looking at longevity, versus looking at bone mass, all these different things. But even in your own life, if you are training for a marathon that you want to cut your time from last year's marathon, you're going to need to train harder and exercise harder than if you're somebody who's looking, saying, I just want to make sure that my, when I get to the 70s and 80s, my quality of life is better. Those are two different exercise programs.
Right. So, where you are really matters as well. The great Kenyan marathoners have a saying that they don't run slow in practice, because you're not going to run slow in competition. Why would you run slow in practice? But I think, for most of us who are not, Kenyan elite marathoners, what you're saying is absolutely true, that, getting out there and doing something, even if it's not sweating, even if there's no pain, still is a big benefit in terms of reducing risk for chronic disease. Again, anxiety, depression, mental health, happiness, all those things are affected without needing to sweat.
And so, Barry, here's a big one. And we hear this all the time, and it confuses people, I think, because I don't know the answer, and hopefully you do. But 10,000 steps, 7,000 steps a day, not even paying attention to your steps. What do we need to do?
Yeah. So it's funny, this magic 10,000 steps a day, which, has become kind of this like dogma, like it was written on the Rosetta Stone. And there isn't great evidence that, that's a magic number, that if you're below 10,000, that's not good. And if you're above 10,000, it's better. I think for most people, you'd say, if you could get more steps today than you did yesterday, that's probably good. Certainly, 10,000 steps equates to about 5 miles. If you're moving around for 5 miles a day, that's probably great. But no, if you've done 8,380 steps and yesterday you did 6,000, I say that's a win, regardless of whether or not you did 10.
So just keep it up and keep the numbers up, and not necessarily focus on a specific number.
Yeah, and again, for some people, that is what motivates them. Some people, who are compulsive, need a number. You need to tell me exactly what I need to do. And in that case, fine, pick a target. And that's as good a target as any, but there's nothing magical about it.
And there's two different ways of saying this. You mentioned this earlier, no pain, no gain. When I was in the military, they used to always tell us, pain is weakness leaving the body. So it's a thing you want to do. You want to get to that pain threshold. Is that true?
Again, if your goal, and you brought this up, if your goal is general overall health, whether it's mental health or physical health or emotional health, then there probably isn't a need to really do that very high intensity. I'm in pain, I'm suffering, but I'm going to be a better person for it. On the other hand, if what you're trying to do is really improve performance, or you're really trying to, increase your fitness as much as you can, then yeah, you kind of have to add that, some pain, more gain, mentality.
Sounds like you're saying it depends.
I'm trying not to say it depends.
I say it all the time. Best time to exercise: morning, evening, middle of the day? We hear a variety of different things.
Yeah, and we don't really know. The dogma is that it doesn't matter when the best time of day to exercise is the time that you'll actually get out and do it. What's interesting, and there has been some good evidence, especially for people who are exercising to prevent, prediabetes or manage prediabetes or diabetes, or maybe even heart disease, is that timing exercise around meals may be useful. So in other words, if you are breaking your exercise up, if you're doing 30 minutes a day and you do 10 minutes after breakfast, 10 minutes after lunch, 10 minutes after dinner, in terms of blood sugar regulation, that might be better. Like you actually might see tangible benefits from timing exercise around meals. Funny, it goes back to, the European model of going out for a walk after a meal, right? It's almost like they knew.
And this is one too I get from a lot of people, a big question here. Am I supposed to wait after eating to exercise? And you kind of talked about that a little bit.
Yeah, and again, it's personal preference. There's no physiological reason to wait after eating. There's certainly potentially, if you eat a big meal and then go out and exercise hard, you may regret it. But that's really, again, personal preference. There's probably even some evidence that exercising close to meals might even be better in terms of blood sugar regulation, not necessarily other things.
You're bringing me back to my high school cross-country days where I ate a hamburger way too close to having to run. And
oh, absolutely. We'd go out, right, and eat these hero sandwiches and then go to practice.
So can people over-exercise?
Yes, I mean, for sure, and there's certainly a big literature on, especially people with eating disorders who tend to couple that with, one of my favorite terms, hypergymnasia, exercising too much. But also, people can do too much exercise. We've actually did a study not that long ago looking at whether, men and women, and Colorado is a great place to do this, who are doing 14, 15 hours of exercise a week, ultra marathoners, triathletes, whether that has a detrimental effect on the heart. And we, like other people, didn't really see that. So, I don't think you have to worry about taxing your heart or your other organs, but, musculoskeletal injury, if you never exercise, you're unlikely to get a musculoskeletal injury. If you exercise, you're more likely, shin splints or knee problems or elbow, it comes with the territory.
Here's a big one too, and I think everybody's guilty of this. I myself have done this a few times, more than a few times, where I work out and I'm like, okay, I worked out for half an hour, so now I can eat that bowl of ice cream.
Yeah, so that's a big one, and that kind of gets at another myth that the myth that exercise does no good at all in terms of weight loss. And that's not true, but exercise without also some attention to diet is not that effective as a weight loss or weight maintenance tool. There really has to be an accompanying dietary change, because you're right, you burn a couple of 100 calories exercising, you can make that up and then some, with a Frappuccino, not to give Starbucks a hard time. So there has to be, if one of your goals is weight maintenance or weight loss, there has to be something you do dietarily as well, whether that's eating fewer simple sugars or eating more fiber or adding kumquats to your diet or whatever it is.
How do you deal with soreness or an injury when it comes to exercise? And there's a distinction between the two, right? Being sore and being injured.
There is, but for people who don't do a lot of exercise, often they don't really know the difference, because until you've had some experience with it, it's not that obvious. That soreness is something that lasts a few days, usually because you've done something you haven't done before. I'm not a member of CrossFit, but I do like the kind of stuff they do. And my girlfriend, Melissa, is a big CrossFit fan. And every once a year, she forces me to do this Murph workout on Memorial Day, which is brutally difficult. And, I can do it, but, for a week afterward, I can barely brush my teeth. But I know that's soreness, that's not injury. So part of it is realizing that, the soreness you get, if it doesn't resolve in a few days, then that's probably more than soreness. That's probably something related to injury and needs to be paid attention to.
So pay attention to your body is essential, kind of the big thing.
Right. Another one of those platitudes, which is also true.
So Barry, I want to ask you a couple more questions. And one of them is, what's your favorite exercise?
I've been running since junior high school, and I'm now 63, and I still love it. It's changed a lot. I actually do a lot more higher intensity running and a lot fewer miles. I do hardly any miles anymore. It's just all fast. But I also like playing around with this, CrossFit-y kinds of functional fitness stuff. I'm too cheap to actually join the place, but I will find out what the workouts are and do them. I do some indoor rowing. I decided when I turned 60, I wanted to be like a world champion indoor rower, and turns out that, the real rowers are much better at it than I am. So I like it, kind of, I go out and, cycle. So I like a variety of things, but and this is really hard for a lot of people to get. It's easy for me. I like exercise. I see it as a reward. That is not common. Most people don't see it that way. And that is something I have to keep track of, that it's difficult for many people to exercise, whereas I love it.
And that's great. And I feel the same way. Like I said, if I don't exercise, I can get a little grumpy on the days I don't. So really look forward to it. The last question I have for you is, are you an advocate of standing desks?
Well, as a department head, I've provided standing desks for pretty much everybody in the department. And I'd say that they are used sometimes. My feeling is that it's a great start in terms of, if you're standing at your desk, you're more likely to actually take a break and walk. I don't know if standing per se, and I think the evidence would bear me out, standing per se is really that great. In fact, might not be in terms of musculoskeletal health, but in terms of it being a midway between sitting and moving, I think they actually do help in that regard.
Well, Barry, thank you so much. And I definitely need to have you back, because you brought up so many topics that I want to talk about: HIIT exercising versus long distance exercise, all these different things. But we have to have you back for another session to talk about that. So please come back and talk to us about this, because exercise is a big component here. But
absolutely, anytime.
Again, Dr. Barry Braun, he's the Executive Director of Human Performance Clinical Research Lab and the head of the Health and Exercise Sciences at Colorado State University, an exercise guru. So thank you for helping us out understand this a little bit better. And like I said, we'll look forward to more conversations so we can get even deeper in this.
Good, thank you.
All right, have a great day.
Thank you.